Hi, my name is Charline. I'm going to shoot a video about electronic health record. Electronic health record is a digital version which used to record the data of patients where they are secured, no one can navigate through them. The components of electronic health record are patient component management, which is in this component is where we found the information of patient, which can help provider to identify patient. Clinical component is a component which composed by multiple subcomponents. In this component we found which is computerized provide ordered entry. This subcomponent helps the provider to enter the patient data in the computer in order to use different tools like drug allergy, and drug diagnosis. The second subcomponent of clinical component is electronic documentation, which help provider to record different information of the patients. The third subcomponent of clinical component is pharmacy system, and this subcomponent help the provider to find out the way of providing the drugs to the patient, or formula can be used to provide medication to the patient. The fourth subcomponent is nursing component, which help the provider to collect the basic information about patient. For instance, to know the way of patient is suffering, the sign of diseases, and the output and input after the laboratory exam. The association benefits of electronic health record are the results from clinical are cared and secure. This means that information related to a patient, a provider is the only people who have to know it, where is stored, the time to deliver it, who is eligible to receive that message. The associate issue is that it can happen that a patient can have mental disability or can be old. This can because of this reason, it can be hard to keep the output of clinical for them, as there is a law of keeping confidential the result from clinical to the provider. However, if a patient is in those cases said above and is having guardian where she is informed to the clinical information, this because the patient is unable to protect the information, there it can be an error of not keeping privacy the information of the patient. The information is spread out, which is a big issue. The two components of electronic that support administrative process. The first one is radiology information system. This component is how to the photo and information related to the output of patient, picture of the patient, management of working flow of the patient, archive which contain patient information, the identities of patient. The second one is billing system, which is related to the charge of patients, how they are treated, which care they are receiving or they are provided, which insurance they are using, and if they are receiving the care about the insurance they use. Overhead on top of the core application layer is the sub component which help the electronic the professional of healthcare to control the element or strategies used to perform. Again, it controls the expenses used by the patient, what they need, and how the electronic health record is working, how it's supporting the patient and the provider, or how the information of patient is stored and kept. The government is playing big role set by setting rules and regulation to help electronic health record system work well and provide good results. Again, as electronic health records require to be adopted, training to know how to use it, and finance, the government are there to provide all of them. Among these activity require norms and regulation in terms of better than. The benefits are related. The electronic have improved legal and regulator compliance, again has increased the way and strategy of conducting research. The issue is that, as we know, that the patient information files are protected and are locked with the passport. The file will be assessed by the provider who are eligible to go through them. These require rules and regulations to follow in order to perform the security of patient information. A provider can have conflict with, for instance, a provider can have a conflict with a patient. Again, a patient can be having conflict with another person. The outside person can have a communication with the provider, and the person can deal with the provider to make out the information of the patient. The provider sent the patient information to the person. The patient information went outside of the people who are not related. From this, the provider destroyed the rule and the regulation to have confidentiality of the work. The importance of integration of administration, that administrative and clinical area for effective use in electronic health record. Integration of administrative and clinical area has been played a big role in where usage of electronic uh, health record, while intervene in research of getting the right information on the different use of electronic health record. Furthermore, the administrative use much effort to know how electronic health record can be used. The advantage can bring at hospital while using it. Again, they have to try to balance the result by taking the result after making the research while taking decision how it will support the patient well as the provider in different ways. Or also they learn how it will work and the requirement or functionalities to use it. Thank you.